Photography is important for clinical documentation for the medical record. Communication with the patient. Before surgery, the chance to look at the photograph of the patient together, I find, is very powerful, because when they see themselves on the screen, it's a different experience even than looking themselves in the mirror. I think the physician and the patient get a more objective analysis. And then, of course, after surgery, photography is a very important tool for communication so that we can objectively review the result of surgery together with the patient. For research, I find photography invaluable. In fact, when I'm trying to set up any kind of clinical trial, standardized photography, I think, is the most powerful way to assess outcomes in orbital and ophthalmic plastic surgery. Communication with colleagues is critical. We're all sitting in these lectures today seeing many pictures of patients before and after surgery. That's the way that we communicate our outcomes, but having standardized, repeatable, consistent photography is a critical element in publishing or teaching about the work that we do. And finally, photography represents the physician and the specialty. I notice everyone in the audience is dressed very professionally with a tie, with their nice clothes, and their shoes are shined. Well, when you go to a meeting or you're going to a patient, photography is the same thing. It's the way that you present your image to your patients and to other physicians. And so our work is fun because we all talk about facial beauty and facial structure and trying to change the face. And so having photographs that reflect the attention to detail and the attention to aesthetics that's part of our profession, I think, is a critical element in success. And Melinda, you were talking about the things that build an aesthetic practice. I would propose that beautiful photography is one of the ways that you build a reputation for doing beautiful work. So let's talk about how we can make beautiful, accurate photographs. In this talk, I only have 2 slides on equipment, because I don't think equipment is the big issue. But when we talk about equipment, lighting is very important. It's the most important thing. The lens focal length is very important, almost as important as lighting. The camera is inconsequential. Every camera made nowadays, including a $50 camera that you get at the drugstore, is more than sharp enough and accurate enough to do the work we need. So the camera's not important. So let's talk about the 2 important things. For lighting, we want even, repeatable lighting. I've found that a ceiling-mounted strobe and softbox, as seen here, which is $800 US, maybe less in India, Melinda, is a spectacular source of consistent lighting. For the lens, I like a lens at the range of about 120 millimeter equivalent. If you know cameras, with the new digital cameras, there's a conversion, so that's about 80 millimeters. And so I just get an inexpensive zoom lens on a standard SLR camera. We set it at 80 millimeters, and that's a very good focal length. For close macro shots, you can just attach an inexpensive 4 or 10 diopter lens on the front of the camera to get the macro telephoto lens. And finally, to trigger the strobe, this is new, Melinda, since you were here. We don't have the aluminum foil anymore. We have a radio frequency trigger now to trigger the strobe in the ceiling off the camera. But now let me focus on what I think is more important than the equipment, and that's the concepts of an ideal photograph. It has to have standardized head positioning, consistent, soft, artistic lighting. I already talked about the importance of lighting. A non-distracting background, the portrait telephoto lens in the 100 to 130 millimeter range in the equivalent, and the special views as needed. Let me briefly talk about each of those principles. Head positioning. The head has to be on the plane of the film, not tilted. The eyes are looking straight forward. The facial muscles are relaxed. And when we get oblique or chin-up views, they have to be consistent. So here's a patient who Cynthia knows well, with his face straight on the plane of the camera. Now watch what happens as I tip just 2 degrees, and now 4 degrees up. Can you see how that tipping changes the relationship of the eyelids to the eye. Now 4 degrees down, he starts to have scleral show. And here when he's looking straight forward, well, Ray has a little baseline scleral show. But getting that plane accurate is very important. You can see how subtle shifts in the plane can really change the appearance of the eyelid. For the oblique view, I like the tip of the nose to touch the tip of the cheek. Can you see how I've lined that up? Then every time when I take that picture, when the patient comes in for the post-op visit, I'm going to have the exact same relationship. So tip of the nose to the tip of the cheek. For example, here in this patient, I'm showing the effect of Restylane filling of the midface, and you can see that by getting that alignment just right, we can appreciate the change in the shape of the cheek on the other side that I've drawn with that blue line. The point is you can't get that kind of comparison unless the views are identical. In patients with very short noses, like an Asian patient, the alternative alignment is to have the bridge of the nose at the medial canthus. So you can see I've got the bridge of her nose at the medial canthus, but I'm going to take that same alignment each time. For example, here to show the effect of hyaluronic acid gel filling of the superior sulcus. For the chin-up view, I like the tip of the nose to be right in the middle of the eyebrows, right in the glabella, and then that way we can measure the proptosis of the eye with that worm's eye view. So the tip of the nose always lines up between the eyebrows every time we take that picture. So here's some examples from the literature of nicely aligned pre- and post-operative faces, same position, same oblique position, and that allows us to make the comparison. Now let's talk about lens focal length. I talked about this 90 to 100 millimeter equivalent lens. If there's too much telephoto, for example, if the lens is longer than 135, it's hard to work. You're holding the camera, you want to touch the patient, and the patient is too far away. So that's why the 90 to 100 range, you can just touch the patient when you're doing a 2-eye view, and this telephoto macro view is very useful. But look what happens when we get too short. So getting too long is a little bit inconvenient. When we get too short, it's catastrophic. Here's a 135 millimeter equivalent lens, a little bit long. That's at the outside range where you can work with the patient, but it gives us a nice flat view of the face. Now watch what happens as I start to get to a shorter lens. Can you see the fisheye distortion that you get with 32 millimeter wide angle lens? We're going to back out now. That fisheye distortion, to me, is profoundly distracting when you're trying to look at the facial anatomy. And yet, if you take a lot of pictures that people take, they take with that short lens and they get that fisheye distortion. So that's why you need a long telephoto lens in order to get a flat, non-distorted view of the face. Finally, let's take a look at the lighting. The typical on-camera flash, if I take my little Canon camera here that has a built-in flash, it gives a very harsh, unattractive light. You can see, by the way, if you look at the cornea, you can always tell what lighting they use. Here's that little pinpoint lighting. And you can see it's a harsh light. The nose is lit up, the rest of the face starts to get dark. Here's on the bottom is a camera-mounted softbox. Now, if you can't afford a ceiling-mounted softbox, these camera-mounted softboxes are very inexpensive, and they're really a pretty good way to get that same soft lighting. But the ceiling-mounted softbox, as I've seen here, is definitely the most powerful, even light. And you can tell the ceiling-mounted, even compared to the camera-mounted softbox, is a softer, more even illumination without that hot spot that you get from the flash being too close. A reflector below the chin is very good for a full-face picture, particularly if you're interested in the neck area, if you're doing facelift surgery. You can see with this reflector, it lights up the bottom of the face. The background should be simple and non-distracting. I find an easy way to do that is just to take an inexpensive sheet of cardboard like this and put it behind the patient, and we just keep that in the examination room. And then finally, special views. For example, motility views, views of the facial nerve function, smiling in this case, or closing the eyelid, views of the entropion or eyelid margin, macro views. This is with that little screw-on close-up lens, which is a $20 lens. Put it on the end of the camera, and then you get a telephoto macro that can get a nice close view, for example, of that molluscum lesion. And finally, this view over the cornea is very useful to look at the eyelid margin. Let's finish by just checking a few problem photographs from the literature. Here's some pre- and post-op pictures, but can you see how that surgeon has inconsistent head position with the nose down on the left, and so there's no way to compare the result of that surgery. Or here, look at the tilt of the nose in the left and the right picture, and so these are not comparable pictures. They didn't control the plane of the face. Inconsistent, harsh lighting. Here's that on-camera flash. Right? Look at the cornea for that telltale sign, little pinpoint dot. So this is a little flash on the camera, and you can see the whole face is dark. You've got the hot spots, unflattering and unuseful lighting. And then this you'll see very often in magazines or websites where the lighting before and after is inconsistent. This is like room lighting before, probably, flash lighting behind. And so with that inconsistent lighting, there's no way to compare the result of surgery. This is a picture of mine that I noticed, and even here I'm a little inconsistent. If you look at the corneal reflex of the light, you can see on the top the light is a little bit higher relative to the patient, and so there's more shadowing. So even with the softbox, you have to be very careful with the alignment in the rooms to make sure it's the same in each room. Now here's some examples of very unprofessional, distracting backgrounds. I don't see how someone can publish pictures like this. I don't know, is that in their bedroom or something? It's just terrible, ugly backgrounds that are just like coming to a meeting without nice clothes on. It's just very unprofessional when you don't have that controlled background. Please don't come to meetings in the future with pictures like that, because it represents you and it represents our specialty badly. And here's pictures with that wide-angle lens showing that fisheye view. You see how there's distorted face, and by the way, different length before and afterwards, so it just has a very unflattering and very unprofessional look when you don't use that telephoto lens. And please have your residents take the pictures before we put in the fluorescein. And this is very unprofessional also to have fluorescein in the eye when you're taking a picture. So to summarize, we talked about the principles of an ideal photograph: standardized, consistent head positioning, plane of the face flat with the film, consistent, soft, and hopefully artistic lighting that not only shows the accuracy of your work, but also the beauty of the work. A non-distracting background, which is a very simple matter of just getting a piece of cloth or paper behind the patient. That portrait telephoto lens, 100 millimeter equivalent, so that you get the nice flat view of the patient. And finally, always special views as needed to demonstrate the pathology. I hope all of us, as a specialty of eye plastic surgery, can be vanguards. And when we go to multi-specialty meetings, because our work is the best, Melinda, I think our photography should be the best as well. Thanks very much.
Thank you, Dr. Goldberg.